Hello. Hello, everyone. My name is Christina Diesendorf, and today we're going to talk a little bit about generalized anxiety disorder in children and adolescents. So, for an overview of what we're going to discuss today, first we're going to talk about the DSM-5 diagnostic criteria for GAD, then the presenting problems impact on the client. What does that look like in their life and their environment? We're going to look at a research article that talks about children and adolescent interventions and assessment tools specifically. And then really kind of dig into cognitive behavioral therapy specifically, as it's the most recommended and evidence-based intervention option for generalized anxiety disorder right now. And then finally, if you're interested in learning and reading more, I'll have a works cited page at the end of this so that you can see where I got all this information. So first, generalized anxiety disorder is in the DSM with the code 300.02F41.1. It's characterized by excessive anxiety and worry, occurring more days than not for at least 6 months. It's about several events or activities. It's not just about going to school. It's not just about going to grandma's. It's about several things. For children, one of the following is also required. So restlessness or feeling on edge, easily fatigued, difficulty concentrating, irritability, muscle tension, or a sleep disturbance. So one of those is required. So while some presentations of anxiety are really obvious, clients could also it could also come off really masked by a co-occurring problem. So sometimes behavior problems, environmental or developmental stressors, or family dynamics could be exacerbating symptoms. Symptoms also vary in intensity, duration, frequency, and they manifest differently in different environments, situations, settings, and in different clients. So it's really important to establish that rapport and know your client really well. Anxiety does present in 3 ways: a somatic or a physical, a cognitive, and behavioral. So this slide shows some of the physical symptoms, which I think is really important, especially since kids don't have a vocabulary. They might come in saying, "Hey, my stomach hurts. I feel really tired." And that should be, a bit of a, I need to assess for some sort of anxiety disorder. So these are some of the most typical somatic and physical symptoms. I'll just read a few. We don't have to read them all, but trembling, shaking, sweating, tics, dizziness, chest discomfort, frequent urination, fatigue, sleep difficulties, nausea and vomiting. I feel like that's one of the biggest ones. Shortness of breath. And so these physical symptoms typically have an kind of an impact on the cognitive and behavioral side. So maybe it starts off with a somatic symptom. A physical symptom is triggered by certain thoughts. I'm not good enough. I'm never going to do well on this test. And just saying that over and over again, well, maybe that causes you to have a visceral reaction. Your heart starts pounding because something's coming up that you don't think you can do. Thoughts triggered by physical symptoms. So say you or having some anxiety and your heart's beating out of your chest and you're like, oh gosh, my heart is beating out of my chest, I'm gonna have a heart attack. So that could also really compound on the symptoms. So typically these are thoughts of losing control, some humiliation, some embarrassment. All of these things are typical in a cognitive response to anxiety. So that affects the behavior. So if you are overwhelmed with physical sensations, thoughts are just taking over your brain that are really negative, that are about, how terrible you are, how bad you're going to do, how much it's going to suck, how embarrassed you are, then you're going to focus on your internal world. And then you may interact with the environment in an unproductive way. And typically that manifests as avoidance. So, say a child has a fire alarm at school, it really scares him. His heart's beating fast. He gets sick to his stomach. He starts having thoughts that, hey, this fire alarm is about me not being safe. And then that means that he's going to want to avoid going to school. So one of the biggest things that we as clinicians have to do is help relearn or unlearn avoidance behaviors to eliminate and alleviate physical and cognitive reactions to anxiety as well. So to diagnose anxiety disorder, there are three basically assessment tools that this article looked at. One is a client and adult interview. And it is recommended that for generalized anxiety that you used a mixture of objective report scales and clinical structured interviews to really make sure that you get the right diagnosis. And so the first one, the anxiety disorder interview schedule, is a semi-structured interview format where you can format the C-P is for one's for the child and one's for the parents. You can get a really good assessment. Both the youth anxiety measure for the DSM-5 and the severity measure are measures that are objective rating scales. The youth anxiety measure is better for use with adolescents or kids who can kind of assess themselves. The severity measure is a list of 10 questions that a parent or their caretaker can fill out every single session, and it helps to monitor anxiety symptoms. The intervention discussed was cognitive behavioral therapy. So that's a combination of 6 main parts: psychoeducation, so informing the child what is anxiety, informing them about their emotions, how to recognize emotions; managing physical symptoms, so letting them know, hey, when you feel like you're short of breath, you can slow down. So teaching relaxation, breathing techniques is part of managing physical symptoms. Cognitive restructuring is about the clinician and the client working together to kind of identify some of the maladaptive cognitive, the thoughts that these children are having, and then help them to find a thought that is more helpful. So in the scenario we'd already discussed with the fire alarm, helping the child say, hey, that fire alarm actually keeps me safe. That could be one way that we could restructure that thought. Developing problem solving, so allowing the child maybe through play to work on how to solve their own problems, letting the client have a lot of direction in that, and then giving them the space in session to say, hey, I could solve this way, or hey, if you're feeling that way, what do you think you could do? I think those are really important skills. Systematic exposure. That means, exposing the child or the client to just a little bit of the stressor and just to kind of improve their tolerance. And I think this is really well done through play. Hey, this dinosaur is going to have a fire alarm. What could he do? And just kind of desensitizing them to some of that. And finally, planning for relapse by reviewing all of these things and letting the child decide, hey, what can you do in the future if you feel these anxiety feelings coming on? So, in summary, generalized anxiety is characterized by excessive worry. Some presentations are obvious, but others may be masked by co-occurring problems or like developmental stressors or a dysfunctional family. It is really critical to do a thorough assessment, and CBT is the most used and evidence-based intervention to date. There are 6 parts of it that we just discussed. If you're interested in learning more about any of the things that we discussed today, these are the works cited. There's a lot of great reading here, so happy learning. I hope that you enjoyed this talk, and I hope that you have a great day. Thank you.